Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And I guess in television, is this what's called a clips show?
Yeah, this and that. It was the title, the clever title.
This and that. Oh, wow. Okay, so you've got some smaller topics. So I assume just topics that might not be a full episode's worth.
Right, but I thought stories that needed to be told. So.
Okay. Well, without further ado, let's slide in. What's our first stop?
So the first one is about the new nominee to the Surgeon General.
Okay.
Wah, wah, wah.
Yeah, I know. Which wrestling league did she come out of? What's the story here?
So her name is Casey Means, and she's the second choice. And unfortunately, I don't have the first choice, but they couldn't.
What do you have to be how bad do you have to be to get eliminated as your first choice in the Trump administration? Wow.
Well, the first choice.
Dr.
The problem is that they're picking influencers in general, right-wing influencers, and not actual physicians.
Right, exactly.
Which is kind of a problem.
Okay, well, what's Casey got going for her?
So, right-wing influencer who is a vaccine skeptic.
Oh, good.
Involved in a business that monitors and collects personal health data.
Really?
Really big on those glucose sensor devices. That are used in diabetics, and they actually have been quite helpful in diabetic care. But
so what are they using those to mine?
Yeah, she's marketing them to otherwise healthy people, which is a little weird. I mean, do you really need to know your glucose second by second?
No. So how does that tie in with the collecting of personal data?
Yeah.
Okay, is that how they're doing it? You enter in all your data, and then do they turn around and sell it?
Right. And so she also, I think, endorses apps that are designed for just that, apps on the phone.
I mean, basically healthcare, health and human services on down, Surgeon General, all of that, it's been turned over to the snake oil salespeople, right?
Exactly. It's capitalism rules there, and critical thought is out the window.
Wow.
But she's in the inner circle with RFK Jr., which is probably what got Trump's attention. She is a medical doctor.
Okay, well, that's something.
Kind of. So she was educated at Stanford, which is impressive, and did her residency partially, 5-year residency, which sounds to me like an internal medicine residency, at OHSU, well-known program.
Yeah.
Depending on who you talk to, she got either disillusioned with medicine in general, which a lot of people can relate to, or she decided to bust out in the capitalistic kind of field. So she dropped out early.
And so did she get her?
She got her degree. You get your degree after the 4 years at Stanford, but she's not licensed.
Gotcha. So she can still call herself an MD?
Yeah, but that's a little shady.
Like MD asterisks or something?
That's intellectually lazy.
Yeah.
But those are two good universities, medical universities. So she was just on the cusp. I think she had like 1 to 2 years to go before she finished her residency. And her colleagues at the time, fellow students and professors, felt like she just couldn't hack it.
Oh, no. And that's got to suck. I mean, you get 5 years. I mean, it's a 7-year residency typically, right? Isn't that
for surgery?
For surgery? Okay.
Yeah,
so they vary in field.
She was in a 5-year residency, which makes me think it was internal medicine.
Oh, she hadn't completed 5 years. She was just in the 5-year residency.
She was there at about 3.5.
Okay, and then bailed.
Or something like that. She bailed.
Wow.
So her justification was she became disillusioned with United States medicine.
Okay.
That's an intense thing, though, to graduate, to get into Stanford, graduate from Stanford.
And OHSU.
And go to OHSU. There's not too many physicians in this area that have that pedigree. There's a couple in the open door system.
Mm-hmm. I mean, and it had to have been a lot of money on her part in some fashion laid out for this education.
Fortunately, she's making it back. And she's kind of, she's now a media influencer largely on nutritional things, and kind of, it sounded like a little bit of longevity kind of focus.
Oh, great.
Okay. But she was never trained in nutritional studies.
Just as an aside, we should revisit the whole Blue Zone thing too someday, because that's kind of unwinding.
Oh, really?
Yeah.
Okay.
Yeah. Yeah.
Oh, send
And
me
it's
the reference. You never
Capitalism.
know.
Capitalism. It's all. Yeah.
Well,
yeah.
actually, yeah, the DASH diet was almost the same thing, but
Right,
that's
right,
data-driven.
exactly, yeah.
That is data-driven. So critics say that she ignores the root causes of the disease. So like genetics, poverty, and that she focuses on the things that she sells as the only pathway to good
Oh my
health.
God.
I don't know why people fall for that.
This is Alec Jones all over again, man. This is
Right.
wow. Okay.
So it's unclear whether the Surgeon General, she is not licensed in any state, although she is an MD. She doesn't call herself MD in any of the references I saw.
Okay.
But it is, so I think that's going to be a hang up in getting her through. But I will bet you they have a fast track license procedure in some red state.
Oh, you think she'll
It's
get like an
happening
honorary MD or
even
something?
as we speak.
Oh my God.
But the problem is that she dropped her license in 2024. There's a certain amount of continuing medical education that you have to log in, and maybe even some board certifications. I don't know if she would qualify for that. It's pretty varied, but it's a thing, and it's not to be ignored. To get licensed in Oregon, I got licensed as a PA. It took me about 9 months. And there was a little bit of bureaucratic error, and it got slowed down because of COVID. But that's a long time. To get licensed as a PA in 1987 took me about 3 months.
Wow.
But now California is known to take forever. Some of the travelers who are looking to move here have problems getting licenses.
Oh wow, because
Yeah,
it's
in California.
more stringent.
But I bet if you go to Alabama, it's just an afternoon.
just get into the DMV.
So I think I have a feeling that's the plan.
So what's her before becoming the Surgeon General, or she might perhaps potentially become the Surgeon General? What's her venue? How is she an influencer? What's her medium? Like, is she on Instagram? Does
So
she do videos? Is she a
podcasts,
guest
yeah.
that people lean on for things? Okay.
Right. Yeah, she's kind of like, think of Joe Rogan. She's kind of in that
okay.
circle.
Oh, good.
So not seeing patients, let me just point out.
You said Nazi. I'm just
Not
saying.
seeing.
Okay,
Calm
sorry.
down. Not seeing patients. So she has no idea of what, let's say, average provider in Del Norte County goes through, or what they see the needs in the county are.
No. No. We all know what her vested interest is because that's what she's making her living touting.
Right.
Well, good. Okay.
So one to watch for sure, and a super disappointment. I mean, think of the previous Surgeon Generals.
Oh, right. Yeah.
Stellar.
Yeah.
Absolutely stellar, oftentimes from the military.
Uh-huh.
Just amazing credentials.
And sometimes even at loggerheads with the president about what they're saying and things.
And
Yeah.
truly committed to good medicine and good public health. And I don't know that this lady's read a journal in a couple of years.
Wow.
So anyway, so we'll keep an eye on her. Kind of disappointing, to be sure. So
God. Okay. Yeah. I just
Yeah.
got stuck in that hell that I get stuck in every once in a while where this is where we are.
Surgeon Generals do important things. Like, do you remember those cautions on cigarette packages?
Yeah, it's exactly the first
And
thing
you
that popped in my mind.
remember, I don't remember her name, unfortunately, but the woman who was advocating for safer sex and sex ed in high schools for young people. Jocelyn Elders, maybe?
Okay.
Comes
okay,
to
yeah.
mind, probably wrong. And, she was talking about safer sex and saying words, like penis on the air, and everybody was losing their mind.
Jesus.
So I don't think that's what we're going to be hearing from this lady.
No.
What is distressing to me is she's not really an anti-vaxxer, but she's a vaccine skeptic. So she doesn't target, this is scary, does not target any one vaccine, but targets the totality of
Just the idea. Of it. Wow.
And then also giving vaccines, kind of the way they do is a single injection has maybe 4 vaccines in it.
Yeah.
And so completely overlooking what we know about antigens and how babies especially are exposed to the world. They could, if they fall over on the carpet, if they're doing the Buddhist and they rock a little bit to one side and fall over, they are presented, their immune system gets 1,000 antigens.
Right. As it should.
Even if you're thinking, but they're on a blanket, but I vacuum, but the dogs don't track in too much dirt.
Yeah.
Stuff like that.
Your kid is a 5-second rule.
So, for babies, yeah. So, she doesn't even know that. I mean, that's pretty proven science.
Wow. Yeah.
But it would cater to the worried parent. An anxious parent would probably eat that up.
Well, and they're very much getting into like just this the whole like hyper muscular Christian thing has come up with Trump. Now they're getting into this whole like alt right like granola mom kind of thing, right? Where health supposedly is, and there could very well be, because there's some things that come out of like RFK Jr.'s mouth that maybe the worm's saying them. I don't know, but when you start talking about getting rid of like superfluous dyes and things that are in our foods, I'm all for that. That's good.
Show me the data, and I'm willing to listen to that one.
But there was a headline and I didn't click on it, so I'm not coming at it from it, but just the headline. And I have a lot of issues with the way the media, there is bias in the media, and there are things that are memed around and passed around that aren't as dire as the headlines make them sound, because even the left side, they want you clicking on their content, so they get dire as well. And it's a thing that we should all address across the full political spectrum. But I didn't click on the headline because it was something about RFK, like basically denying the whole germ theory. And I'm like, come on.
Oh, God.
Come on, man.
Are you
really?
kidding me?
Wow.
Once again, theory meaning fact in science.
Right.
When we mentioned the theory, the use of the word theory last week, I should have pointed out that scientists probably had use of the word first.
Oh, okay. Yeah, no, that's fine.
And then it evolved in meaning just as language evolves.
Mm-hmm.
So
I think that's a huge disconnect with our whole anti-intellectual, anti-science bias, is our misunderstanding of the word and misuse across both sides of the word theory and how we apply it.
And not really interested in thinking about it critically, but just, look, I've always looked at it that way. That's the way it is.
Well, no, I'm talking more specifically about the use of that word.
Right.
And how to the layperson, the word theory means it's still up for debate. And to the scientist, that's not what theory means. No. And I think when a scientist says theory and a stupid layperson hears theory, they're hearing something different.
Right, totally.
That just seems like a key
I think
disconnect.
It just highlights the evolution of language, really.
I think definitely. But I think that
critical thought.
That's something that should be even more than the lack of critical thought. They don't even know that what they're anyway.
Yeah, I got it.
We are. We're on the same page in theory.
That was funny. Oh, that was hysterical. So it's interesting. I think the only way they can get around this is to get her a license somewhere really quick.
And to get quote unquote around this.
But then somebody should ask her when was the last time she worked an afternoon clinic on Friday. Yeah. When there's like challenge after challenge after challenge.
Right.
Okay.
It's just the parade of Janine Pirro is going to be made like a prosecutor somewhere. It's just the parade of quote unquote personalities who are being put in the roles of experts and where experts should be. It's disheartening and it's like clownish.
Clownish. Got it. So moving on to the next topic. This is kind of exciting, and this is what the women who have for many years had to go in for their annual, Women's Health Annual, which really means a pap smear right now. Mm-hmm. We've talked about pap smears before. They are a screen for cervical cancer. Cervical cancer is probably very near 100% caused by the human papillomavirus, which is preventable in the worst case scenario by immunization during the preteen and teenage years.
Right on.
Totally right on.
I can't get my head around the fact that viruses cause cancer. That's just nuts to me.
I can't Well, I'm actually very proud that there are 2 immunizations that prevent cancer.
Mm-hmm.
Hepatitis B immunization, part of the design in it was to prevent liver cancer caused by hepatitis C,
Mm-hmm.
and HPV to prevent cervical cancer caused by HPV.
Yeah,
So,
think about it. That's amazing.
yeah. So this at-home test now, so we're not talking about having to go in the clinic, not even having to go in the clinic and getting handed Q-tips and sent to the bathroom.
Mm-hmm.
This is something you can take home with you.
Wow.
Kind of like the fecal occult blood tests, that many go out to homes, few come back, but it's kind of the same idea. Privacy of your own bathroom.
I found one this morning in a. And I was looking for birth certificates, and,
Oh, of
and I
course.
found one in a file cabinet. I mean, what's this envelope from Open Door? Oh, it's one of the, I'm years old.
Oh,
But
that's
yeah.
funny.
Yeah.
So anyway, the FDA just okayed this cervical cancer screen for public use, and it's going to show up in about June.
Wow.
So that if it shows up in the United States in June, we'll probably see it in about 2 years.
Oh my
But
God.
the maker is Teal Health. This is a super cool thing. And the FDA approved it based on a 600-person study, which I didn't read the study, but 600 people is kind of
Small, right?
yeah.
Yeah.
But remember, this is a screening test,
Mm-hmm.
okay? And so what you want to do with a screening test is not necessarily go for accuracy, but up the numbers, okay? And then
Right.
you can sort it out. That would be the next step. So a 600-person study indicated that self-collected specimens are comparable in efficacy to clinician-collected specimens.
Oh, okay.
So I thought that was cool. But remember, when clinicians do a pap smear in the office, they are looking not only for the presence of HPV, what strain it might be, whether it's high risk or no risk, or low risk, but they're also looking for changes on the surface
Right,
of the
it's not-
cervix. I can't fathom how this would do that, because there's no way somebody's going to be able to
Well, like
get their cervix. It would be like a lucky shot.
like the home fecal and colon tests. I mean, it's just like a first line, right?
Right.
Something indicating a further look. then,
Completely.
right?
So if somebody was positive for, let's say, HPV type 16 or 18, which are the 2 worst kinds, just before we went on the air, I went into an app I have that is a pap smear management tool, and I worked it on a hypothetical patient who was 25 years age coming in, getting this done for routine screening, and only had the HPV. And that's apparently a thing now. So that's totally acceptable. And then it talked about if it was positive, you go in this direction. If it's negative, you go in this direction. So if it's negative and you have no evidence of the genetic material of the human papillomavirus, then the whole thing is repeated again in 5 years unless there's a clinical change.
Okay.
So I think that's super cool. The plan is for it to be less than $600, but I don't know that insurance would cover it. I do think that if somebody came into a clinic to get a pap smear and that's all they were there for, and nothing was found to be abnormal, it completely turned out to be a screening visit. Nobody mentioned that their ear hurts or, some other complication that needed to be addressed. Then I think that would be cost effective, depending on how much it is below $600. So that could, the insurance are either not going to like this at all, or they're going to go for it in a big way. There's not going to be any middle of the road, I think, response.
Why wouldn't they like this?
Well, if it's cheaper to come in and let's see the women's health PA at the clinic, and it's a straightforward exam for an established patient, that might be $80
Oh, gotcha. Okay, I see.
or $120. And if the test, you can add on a little bit to that, maybe $100, $200 for the actual test, Then you see how things are piling up. It could, I think right now they could be very comparable cost-wise.
And so, yeah, and so if all things being equal, I could see that because, I
Right.
mean, you've got to, for them, they'd have to have the patience and perspective, patience and perspective to see to recoup the costs of this screening test. What you're doing is you're cutting down on more
Clinician time.
and subsequently higher costs when you have to treat a cancer that develops or something like that.
So what's
right?
going to happen is that there's a lot of confusion that women have when they come in to get their women's health annual or their pap smear, whichever they call it. In my age group, so I'm 67, that meant that you had an hour with the provider to talk about every reproductive health thing that you possibly could think of. And a lot of women still think that's what it is, whereas providers, what it's morphed to, because it's been demonstrated that, that kind of access to care doesn't, it's too expensive and it doesn't help mortality and morbidity. So they don't want it just because the patient is comfortable with that. So I think there's going to be a lot of confusion in women about what exactly this test tells them. And there's going to be a disconnect between what women are asking, the questions they have, and what the answers they get are.
Yeah.
Because I think it surprises women, especially in my age group, that, you don't start getting a pap smear as young as we were told to get them, that you don't, it used to be must come in every year. And I know that birth control pills were not refilled based on somebody's compliance with coming in for the exam. So,
Wow, okay.
So there's a lot of things that have been attached to that exam, and they're not things anymore.
Wow. Okay. Okay.
Yeah, kind of interesting. But this testing applies to patients who have a cervix, ages 25 to 65 years old.
Okay.
Yeah.
I don't know. It just seems smart to have, and it seems like that's such in healthcare. First off, moving in the direction of more screening, and that as technology changes, as access changes, that we get more of those screening scenarios happening at home. That just makes sense.
Right. I mean, if you think about it, pap smear is kind of an invasive thing. And I always, there's a million things that are uncomfortable about it. And I always make the joke, if men had to get pap smears, we would do this differently by
Yeah.
now.
Right. Yeah.
So I think that day has come, and it's exciting.
Yeah. Right on. Now, this last one, and we do have time. We've got time.
Good.
Last time I read in the email, just as a first pass earlier today, is head bugs. So I'm glad that it's
Oh, okay.
I don't know if I'm glad or not, but it's not. It's
It
bed
could be.
bugs.
It's bed bugs, and how gross is that?
Yeah, it's pretty gross.
So we're coming into tourist travel season, and it's kind of interesting from the urgent care perspective of what tourists bring to us besides their dollars. Because you can, there's a round of strep, or there was that time that norovirus hit one of the local restaurants, and as an urgent care PA, I could kind of watch how norovirus spread through the community.
Oh, wow.
Yeah, because I think I was lucky enough to have awareness of it on about patient zero.
Really?
But yeah,
There's a patient zero coming through town?
patient zero was incontinent a stool in the bathroom of a local, and then it was off and running.
Oh, no.
It was gross.
Wow. Okay.
Anyway.
Okay. Whoa.
So bed bugs are a real problem, and they're a bigger problem in areas with high density, but they're also a significant problem in areas that have lots of people passing through,
Okay.
and so travelers. And that's kind of what we do in the summer. They're parasitic insects that feed on sometimes domesticated animals, but mostly human blood at night. Oh my God, it sounds like a vampire. That's funny. And then the bite sites get really inflamed and itchy, and they look horrible.
Just imagine the vampire movie. You got the two spots on your neck,
Right.
and they're all like itchy. I don't know what bit me, but it's
Right. And they're in a linear pattern, which would,
Because they're just kind of like walking along. So
yeah, they're walking and taking a little sip and going further down the road. Anyway, the site gets really inflamed and itchy, and for a healthcare provider, how about a mom? A concerned caretaker. It's horrific. It looks like, what happened to my kid?
But you say here specifically, they're not capable of transmitting other
Right.
diseases.
So
The sites.
it's kind of like head lice. They're more horrific than they are vectors of disease.
Okay.
Okay. So they're more related to, like I said, to population density, and nobody should get judgy about hygiene. There's always the mom who knows what kid's house, what kid passed it along. Anyway, none of that is relevant here. Okay, but I was a medical chaperone for my daughter's school for the Ashland theater trip. I went on a bunch of them, but once we stayed at kind of a group, domicile, and we were the boys who they put in the basement woke up. The boys always get segregated a little bit because
Sure.
yeah, because in that age group, there's just a lot of smells and things associated. Nobody wants to deal with them anyway. They all woke up with these horrible bites and the really red welts in kind of a linear pattern. And I knew what it was, but to try it, they're all texting their mom at home, and all the moms, like there was a massive mom freak out.
Oh, I bet.
Yeah, but they're easy to treat. You treat them topically with over-the-counter hydrocortisone 1%, and then antihistamines. I think Zyrtec would be preferred, but that's just me. But they live in the mattresses, the mattress seams, in the cracks in the wall.
Cracks in walls.
God,
oh my
it's
God.
disgusting. And they can be brought home on luggage or clothes. Okay. And they go 300 days without a meal.
Oh, wow.
So if you have one in your luggage and you're like, I'll just put him in the garage for a good long time.
Yeah.
And you wait 60 days, that's not going to work.
I'll be damned.
It's not going to work. So usually kids are miserable because the welts are quite itchy, and usually they're on exposed skin. So, you can see them like on arms or legs. So if you're going through Ashland and you're wearing shorts, everybody is going, oh, stay away from me.
Oh, really? Seriously? Oh, no.
Yeah, those poor boys. The extermination method is mostly heat. I thought that was interesting. I didn't know that. Aggressive vacuuming, scraping surfaces, so probably getting into the mattress seams with a scraping tool, and washing in hot water.
Okay.
Okay. So that's also an important tip for scabies, is washing in hot water and drying up at high heat for a prolonged period of time.
Any idea how high a heat we're talking here?
Well, my dryer had, when I had kids this age and head lice was a thing, my dryer had a biologic cycle.
Oh my God, really? Oh, that's brilliant.
Yeah, that's what I thought too.
Wow.
And so it was normal it was higher than a normal high heat cycle.
Sure.
I mean, it was really hot when they came out, and it was 90 minutes.
Wow.
So prolonged.
We will
and
kill
hot.
what's going on here. Anything biotic.
Yeah. So insider tip, although a lot of moms wouldn't buy into this, if you have to do your laundry at the local laundromat and you don't have enough quarters to wash all the stuff that's kind of clean anyway, except for, scabies or bed bugs, then don't do the washing part. Go to an extremely hot 90-degree cycle for the dryer, and you could probably get more accomplished doing
Wow.
that.
Okay.
Yeah.
Interesting. That's very interesting.
So, anyway.
So does Casey Means, is she a bedbug skeptic? Is that a thing?
Well, she travels a lot.
Oh, no,
Maybe she has
she's a vector.
secrets. There are also not really any effective insecticide treatment. So I could just see somebody going out and trying to grab multiple cans of Raid and trying to bomb their house.
Bed.
Will not work.
Wow.
Okay. And if you want to take your mattress outside and leave it outside for a while, you have to leave it outside for like a year.
Yeah, because that one, it's not.
That's not.
You're not going to get it hot
either.
enough. It's not going to be. Yeah.
Right.
So what do you do with the mattress once you get bed bugs? You just vacuum it and vacuum it and vacuum it? Okay.
Yeah, you get like a paint scraping tool and you scrape the seams and then you aggressively vacuum. I don't know what that means. Do people not aggressively vacuum.
Yeah,
I thought that was a mom
just
thing.
passively vacuum.
Yeah,
I don't
just,
know.
kind of doing it because mom told me.
Wow.
So be prepared because this kind of stuff is going to happen.
Lynn, thank you very much. This was a very fun episode. I
It
enjoyed
was
this.
fun.
All right. We'll see you next week.
Alrighty.